Welcome back. It's still Thursday, and we are talking about health and wellness. And what do you need to know about type 2 diabetes and the potential to reverse the effects of it? It's a devastating diagnosis. Recently had a very interesting conversation with two individuals all about this. So let's take a look.
Today we're going to focus on reversing type 2 diabetes, which is possible ahead of November's National Diabetes Month. We have a patient here who will share how she got off insulin, lost 30 pounds, and regained her health during the pandemic. Whitney Morgan is here. She is the individual who reversed her type 2 diabetes diagnosis with Dr. Jeff Stanley, medical director and physician with Virta Health, who is licensed practice medicine in all 50 states and previously worked as a primary care physician focusing on treating obesity and diabetes. And I'm so looking forward to speaking with them both today. Whitney, let's start with you. When were you first diagnosed with type 2 diabetes, and how did you manage it?
I was diagnosed with type 2 diabetes a little over 5 years ago. The day that I went into my doctor to be tested, my A1C and my fasting glucose numbers were dangerously high. And so I was immediately put on insulin and a pill form of medication. And my system is so hypersensitive to side effects of drugs in general that for the last 5 years, it's been nothing but a constant struggle between multiple doctors and medications to try to get these numbers under control. So the reason, having to try different medications was only because they weren't working and they were causing more harm than good. So it's been a real struggle up until recently. And the last couple of years, I've had to try 3 different medications together just to keep my numbers under better control, but they still really weren't.
Dr. Stanley, what are some common symptoms of type 2 diabetes, and what can happen if it goes untreated?
Some of the most common symptoms of type 2 diabetes, and the ones that tend to lead people to go in and see their doctor and get tested, are things like increased fatigue, frequent urination, or blurred vision. And the other thing to note is that in some people, they may not actually have any symptoms, but if you have a strong family history or have any concerns about it, definitely always recommend going in and see your doc to get that tested. And then in terms of, when folks have poorly controlled diabetes or uncontrolled diabetes for years, it can really lead to some pretty nasty complications. And those can include things like amputations, blindness, and we've actually seen that there's an increased risk of death or hospitalization in people with type 2 diabetes who contract COVID.
And Whitney, how has the Virta Health program helped you reverse your diabetes?
Well, from day one, my doctor through the program took me off of one of the pills that I was taking and reduced my insulin by half. Kind of scared me a little bit because I know how my numbers spike on a full dose of insulin, but I followed his lead. I followed the guidance of my health coach, and by 2 months in, I was actually off completely of my insulin. I've actually lost 39 pounds, not just 30, it's 39. It's a big deal for me. But that was one of the biggest things. One of the biggest benefits was getting this weight back off, and also to reduce the inflammation and the joint pain that I was dealing with as a diabetic. That's gone away as well. I follow a very strict low carb lifestyle now, and I don't waver. It's too important. My life is too important to me to want to eat something just because I'm craving it. And for that reason, I'm healthier. I feel better now at the age of 54 than I did when I was probably 30 or 35. And I'm cooking healthier meals for my family as well. So, they're eating healthy meals with me, and we're all benefiting.
And Dr. Stanley, we are just about out of time. What else do we need to know, and where can we get more information about everything we've talked about today?
Yeah, the one thing that I would want to reiterate to folks is that, type 2 diabetes can be reversible. It doesn't have to be this chronic and progressive disease. For anyone that's interested in learning more, they can go to virtahealth.com, see if they qualify. And, really the way that we're able to support people to make these lifestyle changes is through this physician supervision, health coaching, and an ongoing app, so that people can adopt the lifestyle change and, more importantly, make it sustainable so that we see, more and more success stories like Whitney's.
Well, thank you so much, Dr. Stanley, for joining us today talking about diabetes. And Whitney, I also really appreciate you being here with us. Congratulations, 39 pounds, that's huge. I really appreciate you sharing your story with us.
Thank you.